Hello and welcome back. In the first part of this video, the importance of therapeutic relationships within nursing was briefly introduced. The nursing profession's perspective of a therapeutic relationship was also described. The purpose of this video is to talk about the therapeutic relationship from the perspective of the client and the nurse. Clients want and need a therapeutic relationship with a nurse. A variety of literature exists that talks about how important this relationship is to clients within a variety of settings. For example, in mental health, supportive relationships with nurses are valuable in health promotion and restoration. The good nurses in this study were described as friendly, nice people who validated and listened to the client. These nurses were able to help clients explore and work through problems. But clients withheld information when nurses did not establish trust with them or explore their situation. Withholding information was detrimental to client outcomes within this study. This study is a little older, but I like the key messages in it. The article talks about how the things that worked were so simple. Caring, listening, empathy, and use of power are discussed. Communication techniques like reflection and paraphrasing are keys to an effective relationship. Don't be afraid of interacting with people. Just try to understand their experience. Therapeutic relationships are also important in day surgery settings. Clients want nurses who care, nurses who are friendly, comforting, and in the moment with them. For clients to be satisfied with their care, they want nurses who meet their needs, are competent, caring, and pleasant. Nurses also maintain trust through responding to needs in a timely fashion. From the perspective of nurses, much of what is seen as essential in a therapeutic relationship is the same as what has already been outlined. Nurses, like clients, think that listening, caring, and attention to client needs helps to establish a therapeutic relationship. If a therapeutic relationship is not established, it is frustrating for both the client and the nurse. Instead of progressing through the working and resolution phases of the relationship, there is a struggle that ends in a mutual withdrawal from the relationship without meeting the needs of the client. Nurses describe a number of pivotal moments in a therapeutic relationship. Nurses describe feeling honored when clients trust them. They perceive that power in a therapeutic relationship should be shared to promote effective and productive relationships. Nurses also describe the reciprocity that exists in a therapeutic relationship, where they are able to learn from the clients. When nurses are in the moment with clients, they say it can be therapeutic to share something personal. It is important to note that this sharing does not reflect crossing a boundary or sharing of secrets. Congruency and consistency promotes honesty and integrity within the relationship. Patients appreciate the genuine behavior of the nurse. Authenticity within the relationship facilitated the therapeutic use of self within the relationship. These themes of trust, power, mutuality, self-revelation, congruence, and authenticity are interdependent. Because they coexist, there is considerable overlap between these themes. While nurses think that caring for clients is essential, it also necessitates a need to care for oneself. Reflection is a tool that has been suggested for improving the understanding and application of caring in a therapeutic relationship. Reflection helps nurses improve practice and learn from situations where emotional attachment can be therapeutic or cloud judgments. At times, it is hard to know what to do. Reflecting on experiences helps to prepare nurses for future relationships. One of the biggest mistakes novice nurses make is going in trying to solve the problem for the client. Remember, you do not need to fix the problem for them. Here is one of my favorite quotes from the RNAO document. It highlights the idea that nurses do not need to fix client problems. Your role is to help them discover their own solutions to their problem. Interrelated concepts that the nurse must be aware of and apply in order to form and maintain a therapeutic relationship with the client include listening, trust, respect, genuineness, warmth, presence, engagement, compassion, empathy, power, professional intimacy, knowledge, and boundaries, among others. These concepts have been touched on within this two-part video. The importance of each concept and how they can be demonstrated or applied to practice deserves further exploration in order to become a therapeutic nurse. Thank you for watching. If you would like to see more, don't forget to comment below, subscribe, and like the video. Also, let me know what videos you want to see next. I'm happy to make more videos for you.